Assalamu alaikum wa rahmatullahi wa barakatuhu. Hello, our cherished viewer. It is your program once again, Health Check, a program where we give you medical advice from medical expertise in specific fields of their profession. Today, like I told you and always been telling you, that to have a healthy life, you need to be free from all physical and mental ailments. And today, we're going to tackle the bone ailments, that is the diseases or the problems that affect the bones. And the topic of discussion today is osteoporosis. And with me is a physiotherapist. Together with him, we have a colleague in the UK. He's not managed to be with us today here. He's far away in the UK. That is Dr. Zakaria. He will be following, inshallah. And in case we have any questions from you, our viewers, or in the proceeding of the program, we'll ask him, and inshallah, he'll be able to help us here and there. Dr. or Brother Bahi, you've had the topic of discussion today is osteoporosis.
Yes.
First and foremost, it is a scientific name. Our viewer, a layman outside there, would like to know what it means.
Assalamu alaikum wa rahmatullahi wa barakatuh. Earlier on introduced, I'm a physiotherapist. And so osteoporosis is a low bone mineral density that occurs due to altered bone microstructures, leading one to ultimately predisposed to low impact fragility fractures. So osteoporosis, in which low bone mass and microstructure deterioration of bone tissue happens, is a chronic progressive disease of multifactorial etiology. What I mean, it is something that occurs for a long time. It is not something that occurs immediately or instantly. It is something that comes after a very long accumulated damage to the bones. Yes. And it has a lot of causes. That is the meaning of multifactorial etiology. The World Health Organization in 2004 defines operationally osteoporosis in terms of assessment of a person's bone mineral density. And this bone mineral density lies within 2.5 standard deviations or more below the value of an average young healthy women. They usually attribute it to women because mostly it affects them. And the women here that they're talking to mainly are the postmenopausal women. Or if we are to refer to the male, it is the male who are 50 years or older.
50 years and above?
Yes.
Okay.
Osteoporosis, since we are talking about the bone, during one's lifespan, bone mass is always absorbed. But there reaches a time where the bone mass absorption is greater than the bone mass production. Yeah, so with advancing age, someone has that risk of getting osteoporosis because their bone mass is being depleted.
The higher the risks.
Yes.
Jazakallah, thanks a lot, Brother Bahi. Now another question comes. We need to know some facts about this ailment, osteoporosis. What does our viewer really need to know about osteoporosis, besides its definition? All
right. Osteoporosis, as earlier on said, it is, we are mainly talking about the bone mineral density, the bone mass. So the bone mass usually peaks at an average age of 20. So if someone has less bone mass prior to that age, they have a higher risk of developing osteoporosis later in life. And as earlier on already stated, the women have a higher chance of developing osteoporosis than the men because of certain hormonal deficiencies that occur after a certain age. Yes, and osteoporosis is involved with fractures. These fractures have a significant decrease on the quality of life, because this significant decrease of quality of life comes with an increased morbidity. Morbidity refers to disease, increased mortality, which is death, and disability because of the fractures, and also deformities. Most times we grade it in terms of causes.
Okay.
Yes. So some causes are known as primary, some are secondary.
Okay.
Yes.
This now brings me to the causes.
Yes.
What brings about this ailment?
Before we talk about the causes, I would like to first list the types.
Okay.
So we have the primary type.
Okay.
In the primary type, we have one that is strictly called postmenopausal.
Postmenopausal.
Osteoporosis.
Okay.
As you heard the name, this one is mainly to the women. When they reach a certain age, the body tends to decrease the rate of estrogen. Estrogen is one of the hormones that is responsible in the maintenance of bone.
Okay.
But after a certain age, the production of estrogen in their body goes down, and this affects the production and maintenance of bone in their body.
Okay.
So that greatly affects and also influences the risk of developing osteoporosis.
Okay.
So that is one of the causes. The other one is senile osteoporosis. So senile is what referred to as old or old age.
It is for both men and women?
Both men and women.
Okay.
So for this one, anyone who is advancing in age has a risk of developing that kind of osteoporosis.
Okay.
Yes. The other one is what we call juvenile idiopathic osteoporosis.
Juvenile?
Idiopathic osteoporosis.
Okay.
Juvenile is a term we use to refer to infants or children who are yet to be adults. But idiopathic means something that happens spontaneously without the cause being known.
Okay.
Yeah, so this one, yes, it might happen in children, but you may not really have a control over it. Though it is not something very common, it is very rare.
Okay.
Yeah. So those are the three primary types, and we would group that under the primary causes.
Okay.
For the secondary types, things like prolonged use of certain medications can predispose one to getting osteoporosis. So most of these medications can impede the body's ability to absorb calcium.
Okay.
Yes, calcium is very, very essential in building the bones.
The bones, yeah.
But if the body is not able to absorb it, the bones will become weaker. Yes. So certain medications, and not just medications, but also drug abuse, things like excessive alcohol use can affect the body's ability to absorb calcium. The other thing is bone usually responds to load. What I mean, people who are physically active have a higher bone capacity than those who are not physically active.
Okay.
So that means people who lead a sedentary lifestyle, their bone density is low. So they are more susceptible to getting osteoporosis.
Okay.
So sedentary lifestyle becomes another cause for osteoporosis. The other causes are mainly hormones. Like I already told you about the women.
Yes.
Yes, but also these days people do hormone therapy. Hormone therapy in terms of medication, where they artificially take in hormones. Yes, but some of these hormones, if abused or if taken in wrongly, they can affect the body's ability to produce the bone.
And here I would request you to know if there are any complications that comes with it.
Most times, the primary causes, they are already, I wouldn't say that obvious, yes, but they are more like standard.
Okay.
But the complications, we usually attribute some of these to the secondary causes. So there are certain diseases when you have them, yes, osteoporosis will always come in as an opportunistic disease. So when you have things like type 2 diabetes, when you have things like cancers, when you have things like hypothyroidism. So hypothyroidism is a condition where the thyroid gland is affected. I already talked about hormones. Hormones play a great role in maintaining the bone in the body. So if the hormones are produced in low quantity, yes, they can affect that. Okay. So hypothyroidism is one of the conditions that predisposes to that. Okay. The other one is hypogonadism, which also relates to hypothyroidism in terms of hormone deficiencies. Yes. The others could be tumors. I already talked about cancers, yes, but also cancer medications can also bring about those. Okay. What I'm really talking about are already conditions. Yes. These conditions make the body worse and they make the body more susceptible to getting osteoporosis. Okay. But they are also listed as comorbidities or complications that come with. Okay. But the other common complications, of course, are fractures. Yes, when you have fractures, you will definitely get...
And with a fracture, you expect pain as well?
Yeah. Okay. And when you get fractures, if the fractures don't heal well or if they take long, you tend to get the deformities. These deformities can affect your overall body structure in terms of height or stature. Yes.
How can one tell, or how do you doctors tell that such and such a person is affected from osteoporosis?
Osteoporosis, if we are to do physical examinations, it usually does not reveal signs until it is quite advanced. That is one of the unfortunate bits.
Sure. At its early stage, one can tell that you have osteoporosis. If
we followed, let me say, the standards of early detection or screening, let me say, if we went and told risk groups like women who are yet to go into their postmenopausal stage, or those who are just into their postmenopausal stage, to go and screen and do tests that involve invasive, let me say, lab tests or use of x-rays or use of machines, those tests may be able to identify it at the early stage. But if we are following physical examinations, the signs rarely reveal at an early stage. Okay. They reveal at a later point when it is advanced. And at that point, a person is already exhibiting things like loss of height.
Sure.
Yes. At that point, a person is already exhibiting things like kyphosis.
Kyphosis, what's that?
So kyphosis is a malformation of the thoracic bit of the spine, where they hunch.
Okay.
Yes. But these mainly are attributed to what we call vertebral fractures. Vertebral fractures are one of the signs or symptoms of osteoporosis. It is the backbone or the spine is a common place for fractures. And whenever the bone fractures, it tends to reduce in size. It is compressed. So when it is compressed, definitely outwardly your height will be affected. And also the way your backbone will change. That's how you start to develop things like kyphosis.
Okay.
Yes.
Thanks a lot, Brother Bahi. Yes. I promised our viewer earlier in the introduction of this program that we have a doctor from the UK, and this is the time I have to bring in that doctor. But let me give the opportunity to our viewer first to ask a question that will bring in our doctor. That is none other than Dr. Zakaria. So let me see who is the lucky viewer today to call in our doctor with a question. Let me see what your question is.
My name is Umar Basarirwa. My concern is, are there ways to keep osteoporosis from worsening? And how frequently should I have a bone density test?
Well, Jazakallah Sanal Jaza. Dr. Zakaria, you have been following all the way from the beginning. That's the question from our viewer. What is your take, Dr. Zakaria, on this?
Thank you for asking me the question. The strategy to manage osteoporosis in the UK is twofold. One is to prevent the incidence by doing a primary prevention, and the other one is those who had a fragility fracture to prevent further fracture, which is known as secondary prevention. So in case of primary prevention, we use a risk calculator. There are a couple of them available, but most widely used risk calculator is been launched in the UK by a Sheffield professor, and it's known as a FRAX risk calculator. So within that calculator, you can choose which part of the world you are from. If you're from Africa, you can put the Africa as a continent, and quite a few countries are already signed up or provided the data to have the calculator, and Zimbabwe and South Africa is one of them, if I can remember it correctly. So if you put that calculator and put the patient's age, sex, their alcohol intake, there are other risk factors like, you know, whether they're on a steroid, whether they're a smoker or not, or whether they had any bone mass density done by DEXA scan. If you put that figure, that will automatically give you a risk for that particular person. So I'll share that calculator on the screen. You can have a look at it. So the primary prevention, those who never had any fracture, fragility fracture, the risk has been calculated. And according to the calculation that shows color-coded area like green, amber, and red, mainly these three areas. So if you're in the red area, that means that you need treatment. Amber area would be lifestyle advice, and green area means you don't need treatment. So I'm trying to give you a very simplified way to explain that how we tackle the primary prevention in the UK. But if you had any fracture in the past, like low impact fracture, then we will start the treatment, because the quality of the bone, of course, is not strong enough to withstand a low impact. So we'll start the osteoporosis treatment.
Jazakallah sanal jazah. Thank you so much, Dr. Zakaria, for such a good submission. How can one, you know, some people when they get such diseases or such ailments, they hate life. You getting my point? How do you advise such a person that life still continues? I mean, how do they cope with osteoporosis after they have contracted it?
It would be a little bit unfortunate, because most of the population that would be affected are those that are already old, the elderly.
Okay.
And yes, this comes, most of them, when they are kind of activity, be it in the world of making money or in the world of just living at home, doing activities of daily life, has greatly reduced. It is not as when they were younger.
Okay.
So this condition again greatly impacts on that level of performance.
Okay.
It makes it to reduce to a certain level that makes them very much inactive. And of course, if you're talking about things like depression, yes, this can even just worsen it, because of the incapacity, or because of that feeling of not able to, or you fear if you did, you might worsen. It just puts you in that state of not progressing at all. But with a modern medicine and technology, there have been advancements, and there is good news for people who have osteoporosis.
Okay.
Yes.
What's the good news?
There is medicine that is proven to work, and if taken as prescribed, it can help combat the progression or curb the progression of osteoporosis.
Okay.
But also, their being physically active can also be improved. It is not that when they are diagnosed with a condition of osteoporosis, that's it for them in terms of being physically active. No, they can be physically active again in gradual ways, doing exercises, yes, but also doing it within their limits.
They should not exceed their limits.
Yes, because their kind of fragility of frailty is different from someone who doesn't have osteoporosis.
Okay. And their bones are weak now?
Yeah, their bones are weak. But we can try to improve that through curbing some of the risk factors that we have already discussed.
Okay.
Things like sedentary lifestyle. If someone has already been sedentary throughout their whole life and they reach that stage when they are still sedentary, yes, it will be a little hard to change them from that kind of life they're used to.
Okay.
But one way to proceed further in terms of having a better quality of life even as you age is to try and move away from that comfort zone of sedentary lifestyle.
Okay.
Because with increased physical activity, like I said, when you apply load to the bone, the mineral density increases. Yes.
Okay.
So if let me say it is hormone deficiency that is happening, you can be given the medicine to try and help that, but while also helping the bone physically.
Okay.
Yes.
To be physically fit.
Yes.
Okay.
And I wouldn't say there are support groups these days where they get people of the same disease, put them together, share stories of how they have been able to progress, and mainly the elderly. Yes, because most times the young ones who are with them are busy working and are not able to tend to them. But when you join these support groups, they are able to help you see the bigger picture, and you're able to relate with people who are having the same issues.
Okay.
So that in a way can also improve their perceptions about the disease and life going on.
Thanks a lot, brother. Indeed, we are progressing well, and I hope you are benefiting. Brother Bahi has given us hope that there is proven treatment for osteoporosis. So this is the time we need to know what treatment can one have for osteoporosis, or what advice would you give our viewer in as far as the treatment of this bone ailment is concerned, Dr. Zakaria?
The important element is to rectify those rectifiable causes, such as reduction or stopping alcohol intake, stop smoking, reduce or stopping the steroid use if possible, taking enough calcium and vitamin D, healthy lifestyle, exercise, and so on. So all the risk factors that we know, to modify them, that's the first thing to do. However, the drug treatment or medical treatment, medications wise, there are two types of medications available. First type is to stop the breakdown of the bones, and the second type is to build the bone mass. So the first one is known as bisphosphonate group, where you can give alendronic acid or risedronic acid or ibandronic acid. Any of this treatment, either orally or IV. Those people that had problem with the oral intake, they can have IV infusion, intravenous infusion. I'm here trying to give you only the headlines of the treatment. So the drug treatments are very effective. And how do we know whether the treatment is effective? Is to do the periodic DEXA scan. We do 3-yearly DEXA scan. So after 3 years of treatment, we will repeat the DEXA scan, which is a bone density scan, to see if the treatment is successful or not. So if the bisphosphonate treatment is not successful, then we will go to hormonal treatment like teriparatide, or other types of treatment like denosumab injection, and that type of treatments are slightly more effective. So this is how we stop the bone resorption or breakdown of the bones. There are newish type of treatment available, which is to both stopping the bone resorption and to build the bone mass. And they are probably not available everywhere, and a bit more expensive. So this treatment is known as a romosozumab. It is a monoclonal antibody, and it is also given as an injectable form. So this treatment is the only treatment where it does anabolic action, meaning that bone formation will take place. So pretty much treatment point of view, there is a oral treatment like tablets available, intravenous injection available, subcutaneous injection like denosumab available, and teriparatide also an injectable form which is available. Between the teriparatide and denosumab, there are advantage of denosumab that it's only 6-monthly injection. Teriparatide is a daily injection and a bit more expensive as well. So these are the mainstay of medical treatment, but in terms of lifestyle change, it's much more important to make sure that the patient is having enough calcium and vitamin D, enough exercise, and stopping all those elements which can cause osteoporosis, like alcohol intake, smoking, steroid use, and so on.
Thanks so much for the advice, the medical advice. We hope you don't let us down in the next episodes in case we call for your assistance. Please always honor our invitations. Jazakallah sanal jaza to you, our viewer, because this program is meant for you. But unfortunately, time is calling me out. Time is calling me off because I do not have a good relationship with time. I try my best all the time, but still the relationship turns out to be a negative one. But fortunate enough, this is not the last episode of this series of Health Check. I promise you, inshallah, we have more series or episodes coming up for this program. So inshallah, in case your questions are not digested, fully digested in this program, please, we have more other programs to come. And until we meet in the next episodes, I remain your host, Namba Ali Bashir. Assalamu alaikum wa rahmatullahi wa barakatuh.